Okay, welcome everybody. So this is the webinar on Introduction to Health Informatics. We are joined by Dr. Judy Jenkins today, our Program Director to the MSc in Health Informatics. So without further ado, I'm going to pass on to Dr. Jenkins.
Thank you, Cecilia. Good morning. It's 11 o'clock UK. I'm not sure whereabouts in the world I'm speaking to you today. So good morning, good afternoon, good evening, or good night. So I've covered all of the greetings for you. As Cecilia said, my name is Judy Jenkins and I'm the Programme Director for the MSc in Health Informatics in Swansea University Medical School. And what we're going to do this morning is take a very brief look at what health informatics is, how it's used, and a little bit about the course. And at the end, you'll be free to ask me any questions that you like about the programme. So let's start off by defining what we're going to cover today. We'll actually define what health informatics is. We'll examine the role of information technology in the workplace for health professionals, and to examine the role of information technology and information technology skills in supporting modern healthcare practice, to answer any questions you might have, and those questions might be in the form of questions about the programme. So how does it work? How does it run? When am I expected to attend? What will we cover? You might want to know about life in Swansea. A lot of my students are from overseas, and for them, the first time that they come to the UK, Swansea is the place that they might call home for around a year. Or about life as a postgraduate student, because life as a postgraduate student is very, very different from being an undergrad student, and the expectations and the responsibilities from everybody involved are slightly different. Or it may be that you don't already have a first degree and are wondering just how hard it's going to be if you're being accepted on the programme on the basis of your work experience. So, by the end of this session, you should be able to tell me what health informatics is. You should be able to understand the important role it plays in patient care, understand how it is applied and used, and explain what the future of health informatics may hold. Now, from time to time, I might ask you a question, and it would be great when we ask those questions if you could pop your answers into chat, because one of the things that the programme is all about is getting you to think critically about a lot of things, about a lot of issues in healthcare, about a lot of issues in how we use technology. And this is your chance now to start getting your foot in the door and to understand what informatics is about and about how the programme actually works. So we start off with a question first of all. You signed up to do this session. Hopefully you've got some idea what health informatics is. So what do you think it is? How would you define it? If you can pop that in the chat, that'd be great, and I'll be able to read them out and then talk to you as you pop them in. Don't be shy. Nobody knows who you are. So what do you think it is? Okay, application of artificial intelligence in healthcare for the better outcomes. That might be one of the components, so that's a good start, Abby. That's a really good start, well done. Who else would like to contribute? Yeah, Suraj, management of health data using SNOMED standards. That's part and parcel of it, yes. Now, SNOMED is something called clinical coding, and we'll touch on that in the presentation later on. And SNOMED stands for the Systemized Nomenclature of Medicine, and it's a way of capturing health data. So that's another good component of health informatics. So we've got two great answers so far. Let's see if we can get some more in. Yeah, combining IT skills in improving healthcare and analysing the data. Thank you, Shirok. Very, very good answer there as well. Fab. Let's take one more and then we'll move on. I've managed so far in pronouncing everybody's name, so that's good. Sarah, Sarah, your name's a good one. It's the gathering and recording and analysing patient health information for improving healthcare delivery. Okay, so now we've had some answers from you all. Let's see what the research tells us how we actually define health informatics. Put simply, it's the application of information and communication technologies to healthcare. That sounds easy, doesn't it? So health informatics is the science, and it's also an art of getting what we call the 3 R's, getting the right information to the right people at the right time. Now, here's all presentations should always have a diagram, a Venn diagram, or a diagram that has lots of arrows going everywhere. And the more complex, the better it is, because it makes your discipline look terribly, terribly serious. But if we look at this diagram, we can see that health informatics isn't a standalone discipline. It's one that has a foot in lots of camps. It has a foot in health and healthcare, in information science and technology, and in social and behavioral science. So in other words, we're looking at computer science, we're looking at clinical, direct delivery of healthcare, and the social and behavioral aspect of delivering healthcare. And those things might include how we interact with information technology, the human factors that allow us to interact with our technology, our gadgets, our gizmos, how things are implemented, what and why these kind of initiatives are successful. But we also look at, not from a programming point of view. If you're thinking about coming on the course, you won't need to have programming skills. So you won't need to know how to do SQL or Python or R or any of those things, right? But if you've got a background in computer science, that's fantastic, because that helps give you a grounding in how we use and interpret data as well. But when we put all of these disciplines together, we get the discipline that is known as health informatics. So let's take a moment to think about the role of the healthcare practitioner in the 21st century. We could argue that people who work in healthcare, their primary role is to support the delivery of effective healthcare. Because if you're a doctor or a nurse, that's what you're going to be thinking about. How do I treat my patient? How do I make sure that they get better? How do I make sure that I don't do anything that causes them harm? Right? Those thoughts will be at the forefront of your mind. You won't be thinking, when you're delivering healthcare, which piece of technology can I now use? Right? Again, you'll be thinking, how can I ensure professional standards of clinical excellence are met in my practice? But it's also important that anybody who works in healthcare is a holistic practitioner with clinical as well as informatics skills. Now, when we talk about holistic medicine, we mean treating the patient as an entire human being, rather than looking at just the disease that they present with. So if you're working in healthcare and you are a qualified practitioner, then you're going to have a set of clinical skills that will become necessary to treat the patient, but you will also need informatics skills, because, as we know, computing is becoming ubiquitous in healthcare. But you've also got to be responsive and to be able to meet the demands of change. Nothing in the world stands still. And as we go through the presentation and look at some more examples, we'll be able to see how quickly things change. So what kind of systems or technologies is health informatics concerned with? Can you think of any? Shout them out or pop them into the chat section. What kind of technologies might we be using in healthcare? Yeah, somebody in the chat already. Well done. SPSS software. Yeah. Now let me make sure I get your name right. I worked in a hospital here in Mumbai. We used SAP for IPD admissions and everything else. When you say SAP, I'm thinking that you're talking about a demographic patient collection. Electronic medical record software, that's fantastic. DHIS2, wearables, yes. SAS programming. Now, a lot of the things that you've mentioned, which are great answers and fantastic responses, are the things that we don't see. These are the things that happen behind the scenes in informatics. And some of those relate a little bit more to the data science element of healthcare. But if we're looking at informatics applications, what we're generally thinking about and speaking about are electronic health records. Now, somebody in chat mentioned those, right? Now, we would like to think that the people who are delivering healthcare to us have access to the latest information about our presenting diagnosis or disease, and that they're treating us to the best of their ability. Now, unfortunately, in most cases, and still in most countries around the world, electronic health records are yet to be fully implemented, and that we're relying on the old paper-based records. Now, paper-based records are great. They have served us well. They capture patient information and they serve a purpose. But there are huge disadvantages in continuing to use patients' data in the form of paper-based records. The biggest one is that it's very hard to share information in a paper-based record. It lives somewhere. It's not shareable. It's very hard to extract meaningful data from paper-based records because, after all, they're based on text and interpretation, clinical interpretation. So if we utilize digital technology to create electronic health records, this means that we can share information about a patient wherever they are, that we can record data in standard format that we can extract so that we can get reports, and we can use that for a variety of uses. Telemedicine. Now, for those of you who speak Greek, and I'll tell you now, I'm not one of them. We all know what the medicine part means, but the tele part in telemedicine means remote or at a distance. And tele is a word that we use almost every day. Telephone means remote phonics, remote hearing. Television, remote vision, remote viewing. Yeah. Now, telemedicine, especially in COVID times, has seen a massive increase in uptake. And when we talk about telemedicine in healthcare, usually what we're talking about is the use of video conferencing so that we can see patients face to face for a consultation, for a virtual consultation. And as technology has become cheaper and more readily available, telemedicine has become far more popular. Its popularity with patients has risen because in COVID times, it means it's sometimes very difficult to get an appointment to see a practitioner face to face. So now that we all speak Greek and we know that tele means remote or at a distance, what do you think the metri bit means? Now, metri is one of those words. This is a word, telemetry is a word that's got Greek and Latin combined to give us an English word. And metri means measuring. So in other words, metric, the metric system. Now, I'm old enough to remember when we didn't have a metric system in the UK, but you're all young enough probably that you are only used to using the metric system. And quite simply, it means measuring. Now, if I give you an example of this, in Swansea itself, we have two large hospitals. We have Singleton Hospital and we have Morriston Hospital. Now, Morriston Hospital in itself is a centre of excellence for burns and plastic surgery, whereas Singleton has a hospital, although large, has a different function. So say, for example, we have a baby that is admitted to Singleton Hospital as an emergency with burns. The baby is too unstable to be moved. He's in ICU, extensive burns. Right? The plastic surgeon and burn specialist is in Morriston Hospital. They cannot get to Singleton all the time to treat this baby. So using telemedicine and telemetry, which will send results in real time, clinicians at the Morriston Hospital end can advise on how best to treat the patient without them having to move. So that's one example, but we can think of lots of examples where this can actually be used in healthcare if we're talking about things like telecare, where we try and keep people at home for longer. E-commerce. Now, one of the things that we tend to ignore about healthcare is that it's a business. And it doesn't matter if we're in the UK or America or India or Saudi Arabia, wherever we are, all healthcare has costs associated with it. And historically, bureaucratic organizations such as healthcare ones have had a lot of difficulty in doing things like organizing how they buy bedpans or how they buy pharmaceuticals, or actually the whole process of ordering things. But using informatics techniques, it means that we can digitize these processes. And if we digitize the buying of supplies, then it means we can get cheaper discounts because we're buying in bulk. Now, prescription services. I mean, this is one of those things that if you're going to a dinner party, you don't really talk about what's happening in the world of healthcare. I wouldn't turn around to Cecilia and say, have you heard about the latest innovation in prescription services, Cecilia? And Cecilia might turn around and say, yes, I have. I understand we don't need to go to the pharmacy directly anymore. Now, historically, prescription services where you would go to see your GP, and 9 times out of 10, you would get a prescription. Now, that 9 times out of 10 isn't always because it's the right thing for you to do to have a pharmaceutical intervention. Sometimes patients actually pester doctors for a prescription because they feel that if you've got a prescription, it validates your illness. But if we can digitize that, it means that we can control much, much better how, when, and where patients receive their prescriptions. And it means that we can close the loop in how we get access to pharmaceuticals. And that means there's less chance for fraudulent prescriptions. It means that we can actually analyze how much we're spending on prescriptions. And it means a faster and better service for patients as well. Now, in chat earlier on, somebody mentioned SNOMED. Now, SNOMED is an example of clinical coding. And as we mentioned earlier on, electronic health records should be our gold standard because it means that we can standardize data that is contained in a record. The problem with paper-based records is that they are free text and they are based on a clinician's interpretation of what is happening to you disease-wise. So it can be very hard to get meaning out of a record that might be this big, especially if somebody has a chronic disease condition. Now, clinical coding is the science behind extracting textual data from a health record and giving it an alphanumeric code. Now, the one that's most commonly used in the UK is something called ICD-10, and that stands for the International Classification of Diseases. And as you expect, because it's got the number 10 in, it's the 10th revision, right? Second is SNOMED, and as I've said, that's the systematic nomenclature of medicine. And these two systems can help clinical coders, and it is a profession, extract data in the form of diagnoses, so then we can share that for things like epidemiology, business planning, research, and it gives us an overview of what is happening in healthcare. So, for example, where I work in the data science building, I'm part of the SAIL group, which is the Secure Anonymized Information Linkage group. And all of the data that we hold, and it represents a significant proportion of the data about patients in Wales, a lot of that data is based on clinical coding. So say, for example, I wanted to find out how many people had been admitted to hospital with a broken leg and then developed COVID whilst they were in hospital, I would be able to do that by looking at the secondary healthcare data that we hold. Somebody earlier on in chat as well done, whoever it was, talked about decision support systems. Now, I want you to imagine that you are a consultant. You've completed your course, the MSc has got your job, you're already a practicing doctor, and now you're going back because you want to be a consultant. Your MSc has helped you on your way to do that. If you were to keep current with what is happening in clinical practice, you would have to read for over 60 hours a week in order to keep up with evidence-based medicine and what tells you is best clinical practice. Now, clearly, that's not feasible at all. That's more than a working week. The role of decision support systems are algorithm-based pieces of software that can help a clinician make a decision either about a treatment protocol or a drug protocol for a patient. And most usually they're used in primary or secondary care or in a pharmaceutical setting, and they will appear as pop-ups. So say, for example, my GP was prescribing me perhaps an asthma medication, and they start to type it in, the decision support alert will come up with a little pop-up and say, this patient is already on this medicine. This is contraindicated to the asthma drug that you're now trying to prescribe. Do you want to continue? Now, decision support systems are very useful and they have a place, but there can be disadvantages with them. And in one of the modules, module 5, we look at decision support systems in detail, and we look at the benefits and the disadvantages of using them as well. But thinking about these, all of these have one thing in common. That if we're going to use information and communication technology effectively, if you're working in healthcare, you must be competent in the use of information and communication technologies. Now, I've used the word competent there. Right? You don't have to be Bill Gates. Right? You don't have to be a designer for Apple. You just need to understand why and how we use the technology. It's rather like thinking about a fax machine. Now, fax machines are not particularly in evidence anymore. They've been replaced. But if I asked any of you, how does a fax machine work? And I said to you, no, not the fact that you're putting paper in and it comes out the other end. There are no magic fairies in the middle. How many of you would be able to tell me exactly how it worked? You wouldn't, because you don't need to know how it works. And it's the same way with a lot of information and communication technology that we use in healthcare. You don't need to know the science behind the computing bit, but we need to know how to manage it and how to manipulate it to get the right information for the right people at the right time. But it's also important in terms of healthcare that we understand why we're using information technology. So think about the who, what, where, when, and how. In chat, tell me who you think should benefit from the use of from technology in healthcare, and why does it matter? Who should benefit? Should it be the manufacturers, because they're going to make lots of money for introducing software systems into healthcare? Who should benefit? Yeah, both practitioners and patients, absolutely. Right, let's see what the science and the research tells us. Oh, we've got another one in chat, that's great. Everyone, healthcare is inherently socialistic. Right, healthcare practitioners, if we're using technology, people have to understand that there is a benefit for them, and we're not using it just for the sake of using it. So clinicians, most clinicians will be informaticians, but they might not know it. The horrible A word, the hidden side of healthcare, the people that are usually booed, the hospital administrators who get the blame for an awful lot of things, But we do need administrators. Healthcare is a business, so we do need people who manage the business of delivering healthcare. Planners and analysts, because without data, we can't plan for healthcare. And of course, as you all correctly identified, the patient, because we're now approaching a time where not only are patients becoming more and more involved in their own healthcare, and a better relationship exists between healthcare practitioners and patients, but they are becoming more and more adept at using technology themselves. So let's think about some of the guiding principles about using informatics technology in healthcare. We need to make sure that technology is used widely to support health gain. And it needs to be a smart use of technology, and it needs to be a means to an end and not an end in itself. Now, one of the things that I regularly hear is, but we have always done it this way. And if you've always done it this way and it works, and a technology solution doesn't improve that, carry on. That's great. You found something that works. But if we can use technology to improve speed and efficiency, then surely we should actually be actively encouraging that implementation in healthcare. So all informatics technology should improve existing clinical and administrative functions as well. And it should increase effectiveness. And it should help us to think about developing new and better ways of working. One of the modules that we do, module 4, the assignment for that, our students are tasked with thinking of a new health informatics product or development that they can implement back in healthcare. And we've had some absolutely fantastic innovations. People have developed apps, people have designed protocols and systems that have all either made things much more effective or have enhanced healthcare in some way. But informatics is all about having information, as we've said. It's the information to hand when you need it, the right information at the right time. But that information needs to be accurate, up to date, and in the correct format. In other words, it's easy to understand. Now, one of the downsides of paper-based records is that very often they're not accurate, they're not up to date. And we all know, and please excuse me if we have any doctors who are listening, doctors' handwriting isn't always the easiest to understand. If we take all of these things and make health records digital and electronic, it means that we can ensure all of those aims are being met. But it hasn't been easy to get here. The Department of Health, which is an English organisation, in the UK, the NHS is actually split into 4 regions. So we've got the NHS England, NHS Wales, NHS Scotland, and NHS Northern Ireland. Although for ease, everybody always just calls it the NHS. But the NHS were very slow on the uptake of using digital interventions to actually help improve healthcare. And historically, the NHS didn't use or develop IT as a strategic asset. And what was happening is that we were seeing good, usually local IT initiatives that were fueled by people who were very enthusiastic about using technology. But because they were developing things in isolation, those good experiences weren't captured and they weren't shared, which is why it's still 2020-21 and we still do not have a national UK-wide electronic health record system. We have elements of it, and we certainly have glimpses of what it's going to look like in the future, but we're still not there yet. Now, one of the reasons for that is that in the UK, healthcare is funded from taxpayers and from the government, and it's a central function. It's free at the point of delivery. If we look at what happens in other countries where healthcare is based on finance and the ability to pay, IT is everywhere. Now, we'd like to think that that is because it's helping improve healthcare, but what it's actually doing is helping people who do the billing and the accounts get the right information so that they can gather the money back in to carry on providing healthcare. Now, what I want you to do, again in chat, just take a moment to think about the problems that might face a healthcare institution in trying to implement any new IT systems, and explain why you think they might be important and how they might hamper innovation. So I'm going to pretend that you're in charge. You're now the chief executive of Data Science Building Hospital. You've been tasked with implementing a new IT system, health IT related system. Let's pretend it's electronic health records. What problems might you think you'll come across in trying to innovate those? What might they be? Let me go back to that slide. What problems might we have? Okay, the answers are coming thick and fast as well. Yes, setting standards for different data formats. What else? Because standards for data is absolutely vital. If we don't have the same standards, it means we can't share data. It's like me and Cecilia having a conversation, except that I'm going to speak Welsh and she's going to speak Mandarin or Cantonese. We're both speaking, but we're speaking in different languages, right? So we're sharing data, but neither of us can interpret them. Okay, another answer in chat, that's great. Winning people's trust to use the digital health tools. That's absolutely right. Most time in healthcare, when we're thinking about the issues and the problems that are faced in implementation, it's usually about the people. But the problem that we face is that when we're trying to set standards and think about implementing health informatics technology, is that we have a tendency to collect too much irrelevant data. If you think about when patients present in a hospital setting, they might be asked 4 or 5 times by different people, what's your name, what's your date of birth, what's your general practitioner's name? Why do we not just use a central system? Why do we need to collect all of this information over and over again? Sarah, you've just pointed a very good point out, the cost itself to set up the IT system. Yeah, these things cost usually at least 10 times the original costing that was anticipated. And that's particularly true in the UK, where things are very bureaucratic. And we have duplicated things across patient interactions. So if we're thinking about making healthcare more efficient, if we don't have the right system, it means that the process can actually be far more time consuming. As we've said, data formats are different across systems, and systems tend to be specific to each discipline. So we might have a system that radiologists use, there might be a system that GPs use, there might be a system that A&E use. And the problem with this is that the information there tends to live there rather than moving with the patient. And the access to that information also tends to be specific to discipline. And part of the reason for that is that there's limited access across any of the range of systems. But at the heart of it all is the real reason, people and politics, right? There's a saying that knowledge is power. And if you're able to guard the information and data that surrounds a patient, you become important. And that's why paper-based records are very important, because if you have it on paper, it's evidence, it's proof, it exists, and it gives you the power. But we're also seeing what we call the rise of the informed patient. I mean, what did we all do before Google? Yeah, I use Google and my smart apps all the time. I'm not going to say the name of the one I've got here at home, because the minute I say her name, she'll ask me what I want, right? But historically, patients have been compliant participants in healthcare, usually people from the older generation. And if your doctor said to you, here's a bottle of tablets, you take 2 of these a day, you would go away and you would take them because your doctor told you to. But now, because patients have access to the internet, which can provide us with a whole host of health information, patients are moving away from being compliant and active participants and partners in healthcare, right? And as we've just said, everybody's got a smartphone, everybody's got access to Dr. Google. And what we're seeing is that patients are now demanding and getting a say in how their own healthcare needs are met. But what we do know is that change is coming. So here's a little quiz for you. What date was the first telephone call? Pop it in chat. See if you know what date the first telephone call was. That's not my cat, by the way. I don't have cats, and I've locked my dogs in the kitchen so that we don't have a dog interrupting us with the answer. Anybody like to guess? What was the date of the first telephone call? Shall I tell you? Okay, the date of the first telephone call was 1879. All right. Next question. What was the date of the first videotape recording? Anybody like to have a guess at that? It's further back than you think. A lot further back. There's no right or wrong answers here, guys. So if you want to pop it in chat, we won't laugh if you think it was last year. Oluwayomi, good guess, but not quite as far back as that. But well done for having a go. It was actually 1951, right? Sometimes these things are hard to gauge because sometimes they may appear as if they've been around forever and they're actually relatively new. Now here's one you might have a better go at, the date that the first email was sent. Now I love email. It's my favorite way to communicate. 1963. No, close though. It was 1971, so you're not too far out with that guess, Rachel. Oh, I've just given you the answer to that one. But the date that the first mobile phone was launched was actually 1973. Now, I had to treble check my answer because that seems an awful long time ago. But that is the date that the first actual mobile phone was launched. I mean, don't forget, mobile phones really are smaller versions of radio communications. Yeah. What about the date the first video was posted on YouTube? Any idea? I hope you're not all frantically Googling the answer to this. Right, the date the first video was posted was 2005. Right, that doesn't seem to me. It seems to me as if YouTube has been around a lot longer than that. And finally, the date the very first iPhone was launched. Anybody like to have a stab at that one? 2000. Okay. 2007. So it's not that's more recent again, isn't it, than we expect, right? But what we can see is that change is happening quickly. We've gone from the very first telephone call to iPhones, and those two forms of communication are essentially the same. But in a little over 120 years, they've evolved completely differently with completely different uses as well. Now, I know that I'm probably not the only one. I never use my landline, and I'm guessing that most of you don't either. So we know that change is happening right now. It's happening before us. The top 10 jobs that exist now did not exist 15 years ago. And they are mostly technology related. And technology is changing so quickly that if you sign up to do a 4-year technical undergrad degree, by the time you get to year 3, the things that you've been taught in year 1 are already out of date. Newspapers. A week's worth of newspapers, so for example, the New York Times, contains more information than the average person living in the 1800s could ever expect to know in their entire lifetime. And that fact stuns me, because it's, you know, people are people, but because people didn't move, they didn't travel, they didn't have the global access that we do, and they didn't have access to information in the same way as we do. The Internet of Things. Globally, there's over 22 billion interconnected devices. Right? Now, I've got a smart home and my devices are connected. If we look at healthcare, there are lots of applications in healthcare that rely on the Internet of Things. And in one of our modules, we look at that as well, and how we can use things like smart apps to control devices, or to control measuring telemetry devices as well. If Facebook was a country, it would be the third largest in the world after China and India. And that is because the population of Facebook as social media has changed the way in which we interact and communicate. And we can use social media as a very, very powerful tool for health education purposes as well. But 82% of all internet traffic is now video related. Mostly YouTube. I mean, I'm too old to understand what Snapchat is. I don't get it. Or TikTok. I can just about cope with Instagram. But video sharing platforms take up most of the bandwidth on the internet now. There's something called Moore's Law, and Moore's Law dictated that technology gets twice as quick and half as cheap every 18 months to 2 years. Now, we're at the stage where we might be reaching saturation, but it's certainly true to say that technology has become far more affordable, which means that we have no excuses for including it in how we deliver healthcare. In the few minutes it's taken just to present this slide alone, 1,000 babies will have been born. So what we're saying here is, because change is happening, information is being produced. So who and how is all of this information being produced? And the answer to that is we are. We produce the information that we can then turn into data for analysis, and especially so in a healthcare setting. But we can say that we are now living in what's officially called the information age. There's a digital presence everywhere. There's a recognition that communication technology can be used within a healthcare setting, and it means that better information means better clinical decision making. And health informatics has the potential to transform healthcare. So to recap, health informatics is about getting the right information to the right people at the right time. And as somebody once said, who was much cleverer than me, the Stone Age was marked by man's clever use of crude tools. The information age to date has been by man's crude use of clever tools. So this is your opportunity now to ask questions. So you can ask me any questions about the program, life as a postgraduate student, what you can expect as a student, life in Swansea or in the UK. Here's some contact details, but before you ask questions, this is a picture of our latest building. This is the data science building, and this is home to the SAIL database, and it's also home to our students and me when we're able to go in. So that's the outside. It's a fantastic building. It does get very hot, as you would expect with all that glass. This is the inside, and we've turned this into a classroom because last week I was able to offer our students face-to-face teaching, and they were so desperate that they wanted to have a picture, and they knew that I was talking this week, and they wanted to show you that they were all very, very happy. And one of my students sent me this picture, which said, I used to smile and then I studied health informatics. And what this picture is supposed to represent, that it is a tough course, but you will cope with our help and support. You will get there. So these are contact details for me. I've also put a link to the course details in there, and we very much look forward to welcome you to Swansea and to the Health Informatics programme. So I'm happy now to answer any questions that you might have. So please feel free to ask away.
Thank you very much, Judy, for the session. It's really interesting, and really informative, and I'm really pleased that everyone got involved as well. Just quickly before we round up the recording as well, for anybody that's watching this from the recording, if you've got any questions, then you've seen Judy's contact details on there, or alternatively, you're also welcome to get in touch with us on study@swansea.ac.uk, and we'll be very happy to assist you. Thank you very much.